Hi everyone, it's Nicole from the Physio crew, and today we're going to be talking about heel pain. And when I'm talking about heel pain, I'm not talking about underneath the heel. There's lots of things that can cause that, and we can discuss that in another video. But this is actually at the back. So over the weekend, we were allowed to start we were already allowed in people's gardens, but we actually drove up for the day and we sat in my brother's garden. And of course, as normal, the talk goes towards physio related chat, which I absolutely love. So I wanted to share with you about Haglund's deformity. So very, very common in runners. So everyone is getting so excited now. Lockdown's being lifted. We are going to see so many injuries, and I want you just to avoid them, guys. Listen in carefully to try and help to reduce your risk of getting injured. You are not going to be the same as you were 12 months ago, so we really want to be thinking about how we increase load. Now, sometimes where the Achilles joins the heel, you can get something called an insertional tendinopathy. And runners, listen in closely, because you guys are tough. Like, you know that you're going to get a bit of discomfort if you are a runner and you are regularly doing exercise. And you get used to ignoring some of these niggles. But there are two things that you should not ignore if you're a runner. And that is patellar tendon pain and Achilles tendon pain, because it is a nightmare for a physio to deal with when you've had it for 12 months. Of course, it's better to deal with it at 12 months than 18 months, but we know with tendons that we can get them better with the right management, but it makes it much, much harder if the tendon is in a state of a more degenerative form because it's been left for a long time. So things to really think about with Achilles tendinopathy. So the key kind of features of it will be someone who has increased load. So they might have increased the mileage, they might have increased their plyometrics, so they're bouncing, running, jumping, or speed work. They may have been sort of going a few more times a week. So they're sort of now thinking, okay, I want to do this triathlon, so I'm going to start doing a little bit more in various sort of disciplines. Although, to be honest, triathletes are better because at least you're cross training, whereas runners, you're just normally running. And of course, it's beautiful weather now, isn't it? Look at this, lovely down in Devon today. So it makes us more motivated to get out, and especially after the year that we've had, it's a great way to manage mental health. So Haglund's deformity is where you get a little bony prominence on the back, and that can sometimes cause pressure within the shoe. But really, a lot of the time people have Haglund's deformity, and that is not the main problem. Often it can be where that tendon is joining the bone, and then that's causing the compression. You've also got a little bursa in there as well, and the bursa can sometimes get irritated and swollen. So we always look at the retrocalcaneal bursa. We look through the tendon to work out what exercise is going to be best. So the exercises are different. If you have a mid-portion tendon problem, it's going to be different to an insertional tendon problem. And that's to do with compression. What we don't want to be doing is putting lots of compression through the tendon. We want to be loading it at a level that it can cope with. So if you think about inside the tendon, you have got protoglycans. When you get a tendinopathy, protoglycans take on water. You get this kind of disorganization of the collagen. So normally collagen lines up along the line of stress, becomes a bit disorganized, and then you get these little holes within the matrix. And quite often that will cause a bit of it's not swelling, but it makes the tendon look thicker because the protoglycans are taken on water. So we're not really looking at changing that thickness of the tendon. That may change, it may not. You may get irritation of the tendon sheath that the tendon sits in. But what we really want to do is make sure that collagen is lining up along the line of stress. So we do want to exercise. So don't be scared when you come in that we're going to say stop running. Like, it's very unusual that we do that, but it's about managing load and taking sensible steps so that you don't just keep going and then eventually it will stop you. That's kind of how tendons work, is they start by being a bit annoying. You feel them every now and then. You go for the run, it warms up, feels fine, and then you feel it the day after. Sounding familiar? Probably. And so what you really want to do is make sure that you're just increasing the load nice and gradually, and doing enough that you're changing the tendon, but not so much that it's becoming degenerative. So Haglund's deformity, it's often blamed when it's not the true culprit. Achilles tendinopathy, we need to identify whether it's mid-portion or insertional, and then we can work out what are the best exercises, what is the best management for it, and then think about soft tissue stuff that we can do to help facilitate that process. We've got taping that we can do to facilitate. Sometimes a herringbone acupuncture works moves quite well as well. So lots and lots of tools in our toolbox to help get that nice and normal. But best thing to do is, if you're not sure whether we might be the right company to help, just book in for your free complimentary discovery call, because you can either decide, yep, it's great, or you just learn something, you know, it's a win-win. All right then guys, take care. I will see you in the next video. Make sure you're following us across social media, YouTube, Instagram, Facebook, Clubhouse. Take care guys, bye now.